Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about the medical home, and joining me is Dr. Daniel Duffy, the Dean of the University of Oklahoma School of Community Medicine. Welcome, Doctor.
Hi, Pam.
Now, we are going to talk a little bit about the medical home, but before I do, because we just did a program that people may have seen the other week that was talking about changing behaviors. And I asked you before we started that show to tell us a little bit about the School of Community Medicine in terms of the focus of a College of Medicine. So I want to add that to this program for people that may not have seen that program, and so they can understand kind of the distinctions the university has made changing from just College of Medicine to the School of Community Medicine?
That's a great question, Pam. With the University of Oklahoma 2 years ago, decided to rename the College of Medicine Tulsa to the OU School of Community Medicine. And the change in name reflects the philosophy that we have that medicine involves not only the care and treatment of patient illnesses, but also the care of the entire community in which that patient lives. So it gives us an opportunity to actually look at illness and health and treatment from the broad perspective, the context of the community in which it occurs.
Okay, and as a result, when we do make that change in focus, we'll have a healthier society. You just won't see sort of advances in terms of health in one little area or the other, but the whole goal is so that as a society we become a healthier people.
Exactly. It's a holistic view of medicine that applies the principles and practices of medicine to the individual. It applies those to the entire community.
Okay, now let's look at this concept of medical home, because with the University of Oklahoma you have the Schusterman Clinic, for people that may not be aware of that, here in Tulsa, Oklahoma, where people do come in for what we would look at as, from our perspective, traditional health care kinds of things. What is this medical home? Because that would feel more like just going to the doctor's office. So tell us a little bit about the distinctions conceptually of going to the doctor's office and a medical home.
That's a great question. Well, the medical home is a term that has gained popularity, particularly with the healthcare reform act that has been recently passed. It started actually a long time ago, back in the early 70s, when pediatricians who were caring for kids with special needs, such as children with cerebral palsy or serious learning disabilities and so on, those kids needed a team to help them with their health care. So a single doctor with a single office staff were not quite sufficient to deal with the chronic problems that these young kids had. What's become clear over the past 30 years is that more of the people in a community have chronic diseases and resemble those kids than they do healthy young adults. And therefore, to deliver the care, particularly for patients with chronic disease, we need a team to deliver that care. One doctor is really not sufficient. Now, in a doctor's office, there are people, there's a receptionist role, there's a nursing role, and there's the physician role. What we're doing with the medical home is actually expanding those roles so everyone functions at the top of their license. Nurses do patient education. Nurses coordinate the care of multiple doctors who are providing care for that patient. So the medical home is not the old Marcus Welby office grown up into the 21st century, but it is a really new model of care.
So with the medical home, so that we can kind of understand this, especially for people who are going to just see the doctor, is with the medical home, is that where if you needed to have an x-ray, that would just be kind of down the hall or available with, is it a facility concept? It's available within the facility, or is it where you would be referred because there's a connection with this physician and these other practitioners that may do x-rays, or let's say you need to go see an oncologist from your primary care. Is it where they have to be in the same facility, or the referral system and coordination is made from that one particular primary office? How is it?
Yeah, in your question is the whole concept of the patient-centered medical home, which is the full name of it. It isn't about a place
Okay.
Although a patient-centered medical home is usually located in one office setting. But it's really about coordination of care across multiple disciplines and multiple services. So in your question, you said if a patient needs an x-ray, are they just given a slip and say, go find an x-ray? Quite frankly, that's the way a lot of our health care is delivered right now.
Right, right.
What the patient-centered medical home says is no, the patient-centered medical home will coordinate getting that x-ray and getting the results back and telling the patient what the results are and instructing the patient on what to do about it.
Okay.
Now that's just good medical care, quite frankly. But unfortunately, with our discoordinated healthcare system that we have right now, many of us don't receive that kind of coordinated care.
No, we don't. And it seems to me in that there's more chance of error when you don't have this patient-centered medical home, because if I, as the client or patient, whatever you want to call me, if I have to go on my own to go over here to get the x-ray and the report comes back to me and I forget to tell my doctor what it is, or they didn't realize I went to go get it, or I went over to this doctor and then they prescribed this kind of medicine, but when I come to this doctor I forget to tell you that I have it, so you give me something that could be contraindicated to the other medication. It seems like we can just have a bona fide mess, and we do know that there are a lot of instances in healthcare where there are untoward results that didn't have to happen.
You've described the current healthcare system for many of us in the United States right now. And it's that problem, that uncoordinated care, that going from one doctor to the other, patients being responsible for tracking what Dr. A did and what Dr. B did, getting drugs at this pharmacy, getting some over-the-counter things here, and nobody knows what's going on. And as a poor patient, we get very confused by that.
Right.
We're not quite sure. Patient-centered medical home says, no, let's change this. Let's, you and me, form a relationship in building a home together where you can come to one place and get all of your needs coordinated. You may not get them all done in that office,
Right.
but you can be guaranteed that I, as your primary care physician in the patient-centered medical home, and the team that works with me are going to assure that you get the coordinated care you need.
Well, let me ask this question. Oh, I better go to break first.
Okay.
I can hear Jake in the back of my mind saying, Pam, wait a minute. Let me save this question for right after the break, and we'll take a really quick break, and I'm going to come back and ask another question to just talk about. Okay? Please stay with us. We'll be right back.